efforts, Jay. So where can people go to get their shutters today?
Okay, so if you want to get tested, 8 to 11, please make preparations. I mean, I know, and Chris has been harping on it a little bit about the somewhat limited hours of testing and everything, but at least for today and tomorrow, 8 to 11 at the Old Carnival Grounds in Teaden, you can go get your test. You can know your status, and we highly encourage you to do so. Next week, hours will be expanded, as officials have said, but that's for testing. If you want to get vaccinated, please do make sure to hit the URL, tinyurl.com/VAX Guam, and you can make an appointment to go be seen at the University of Guam Calvo Fieldhouse, or if you want to go to a place that is more closer to your village, go to tinyurl.com/COVID stops with me.
Yes. And let's go ahead and head into the KUAM News Zoom room here where we have Dr. Peter Lombard, who's standing by. Good morning, Doc.
Morning, Chris. Morning, Jason. How are you?
We're doing pretty good. I want to say it's good to see you, but we usually only see each other when things are getting hot and heavy.
But he is in a good mood, I will say, because Doc, congratulations on your beloved midshipman.
What's that?
Congratulations on Navy doing as well as they did this year.
Yeah, beating Army, that's all you have to do, and it's a good year, right?
Jason has been waiting to tell you that. So
you ended the year on a positive note.
It's been a few weeks since our last meeting. The game was a few weeks ago, but I was like, what? Oh, yeah, that's right.
And like I said, he's been waiting.
I think those of us here in Harmon, Pete, heard you cheering all the way from your office over there. So, no, it's all good.
All right.
Yeah, thanks, Jason. I appreciate that. And I've thanked you guys before, but thanks again for all you do and getting the message out about testing and where to get your boosters. I think, with the audience that you have, for people to have that access to the information is very, very important and crucial. So thanks for your relentless, determination to get the word out there. And I'm really, it's tough to be here again and to see these kind of numbers. We can just jump right into it if you like, Chris.
Go ahead, Doc.
Okay. Here's where the U.S. sits. I throw this up early on in every presentation. So we were one of the worst in the country and the world back in October, November. We had a terrible Delta wave, one of the worst in the country, and then we were best in the U.S. for well over a month. And now you can see we're upticking, but compared to the rest of the United States, we're still the very best. So even though we're seeing this big increase, we're still holding our own against the rest of the country. Look at New York. It's the and this is per capita, so it gives you some idea of scale here. I mean, the numbers we're seeing in almost half the U.S. are higher than the case counts we've been seeing per capita ever, and that's in over half the states. So this Omicron is no joke. The level of transmissibility is just incredible. So on this slide, I wanted to isolate just the bottom 10 in the country. So these are the best performing states right now with the Omicron virus, okay? So you can see us grouped down here, except for New York. I kept it on there just for scale so you can see the difference. And we're talking about, at least for Guam, maybe a 7-fold difference in the number of cases that you're seeing per capita. And one interesting thing I see here is you see a big Delta wave for Guam and not much one for New York. In fact, if you look at Guam and New York, we sort of alternate times with waves. It's correlation, not causation, but still, it's interesting. But you also see amongst these other low states with low Omicron impact right now, some of them at least had a pretty significant Delta wave. And I throw that out there because I'd like to think and hope, again, trying to be optimistic here, that the recency and the severity of our Delta wave has left us with a certain level of immunity, whether it's vaccinated, then infected, or just infected, that is very recent enough that it's still providing some level of protection against the Omicron virus being able to get out there as much as it would have otherwise. In a population like New York, which hasn't seen much level of active virus at all, okay? So we'll contrast this to, now this is just the top 10. In this case, I just left Guam up here for comparison. These are the top 10 states in the country right now with the Omicron virus. And you can all see all of them, with the exception of Florida here in green, all of them had a pretty mild Delta wave. And Hawaii maybe, but it was shifted a little bit to the left as well too. So interesting to see Hawaii in the top 10. They just broke into the top 10 in the past couple of days. And of course, that's a place where a lot of comparisons are made for Guam. But we're still doing fairly well with Omicron. Remains to be seen. I was actually surprised that it took so long for Omicron to show up here. But I think when you see this level of spike, and if you look at just the slope of how rapidly this is going up, how rapidly it's gone up everywhere else. I mean, I just can't. It's hard to imagine this not being Omicron. What we're seeing out there today. I mean, we did see numbers in the 200s in the Delta wave, but it took a long time to get there, right? And this happened in a matter of about a week. So the only thing that I think really could do that to us would be the Omicron variant here. This was from the public health slides yesterday. Just to reiterate, this is the younger age groups, the middle age groups, 18 to 39 is primarily driving this. This is the group that's out working and moving around a lot more than the other populations. Here's where we stand overall in total deaths so far. We're still in the bottom, just in the bottom 10 in the U.S. for total deaths from COVID. But unfortunately, a lot of those happened to us in the Delta wave. If we hadn't had such a huge Delta surge in deaths, then we would have been sitting a lot better. So we're sitting about 73 deaths per 100,000 since the vaccine was widely available. And when I've shown this before, I don't know how you can look at this and not see how the level of vaccination, which is on the bottom here, the higher vaccinated you're on the right, more deaths you're at the top. So there's clearly a trend towards decreasing COVID deaths the more vaccinated you are. But way out here to the side, there's where Guam sits if we put us at about 85% vaccinated and about 730 deaths per million. So we're a bit of an outlier in terms of the level of deaths, but that was because we had that strange high number of deaths during Delta with a lot of DOAs. And that's in a setting where we're now at least 85% fully vaccinated. Looking at our boosted rate, we're only 30% boosted right now. And unfortunately, 100,000 out of all 130,000 that are fully vaccinated right now are already 6 months from their vaccine. And
yeah.
And it's already moved to 5 months. So now you probably bump that number up even more, maybe 105, 110,000 people. And we've only boosted about 30,000 of them, I think. So we've got a long way to go. And I'd like to, encourage everybody to get boosted that have been vaccinated over 5 months from now, because it definitely shows protection against the Omicron virus. And I'll show a slide about that. So here's nationally, this is the CDC slides. The purple is the Omicron. You can just see the rapid ascent. It's like 95% of all the cases out there in the United States right now. So no surprise that we're starting to see it here. The other interesting thing is that, a lot of people maybe are under the impression that this was this progression of variants from Delta to Omicron, but Omicron sort of developed on its own. It's sort of on this own lineage that predated Delta and then started. So you can see that the genomic variability compared to all the previous variants is very different. When you look at all the differences in the genome structure, it's quite different. So this is more of and what we refer to as the antigenic drift. I thought that was interesting. And it's also remarkable that even though the vaccines were not tailored towards Omicron, it's remarkable that even without any modification, the vaccines are working at all against Omicron. And they are. Even with waning immunity, even if you're 6 months out, you still have about 50% protection against hospitalization versus not being vaccinated. So that's remarkable. And I think that speaks to, we feel very fortunate that we have vaccines at all that are still working against these variants. A number of studies, 1, 2, 3, 4, 5, 6, 7, are showing reasons why Omicron is less severe. The way it infects lungs, it's less likely to get deep into the lungs. It's more in the upper airways, and it's just all of the changes, the mutational changes in the virus. It makes it act differently. And thankfully, we're not seeing as much severe disease, particularly in the setting of people that have levels of vaccination or prior exposure to the virus. And you can see, at least in the UK data, what's referred to as this uncoupling of cases versus deaths. Even though the cases are spiking, the deaths aren't coming up as high as they were with the previous variants. And that speaks to success of the vaccines as well. So, in yellow is hospitalizations and deaths down at the bottom here. Looking at some of the earliest U.S. states, we're not seeing the same level of decoupling. Unfortunately, the hospitalizations are tracking higher than what they're seeing in the UK, and there could be a variety of reasons for that. So I think the real challenge here is there's never one place you're going to be able to look and say, oh, we're going to look like that. Mm-hmm. I think every location has its own unique variables that are going to determine how bad the Omicron wave is. You look at a place like Maryland, for example, they're having a terrible time with Omicron. They're in a position where their hospitals they're canceling elective surgery. They're diverting. I was trying to get a patient medevac to the States, and they're saying, sorry, we're on divert right now. You've got to look at a different city. And that's actually affecting us here in Guam, even the fact that there's certain places we can't send patients to in the U.S. So, even though it's less severe, the sheer volume and numbers of patients that are out there in cases is causing enough hospitalizations that it's still affecting the healthcare system. And it's going to affect people that don't even have COVID, that have to have their other healthcare taken care of. Here's the slide that demonstrates the third dose, the booster shot, increases your protection against hospitalization from 2 doses from 50% up to about 88%. So this is still early data, but it's really encouraging to see that. And I think it's hard to put a chart up here and say, hey, look at this. This is why you need to get vaccinated. I don't know how else to show people there is a real benefit to getting that booster dose. So please get out there and get your booster. It'll protect against hospitalization, and it protects against symptomatic disease. Hospitalizations in Guam, we're starting, here we are at about 13, and hopefully it doesn't go much higher than that. I don't know how many hospitalizations are we going to see with Omicron variant here. We know that there's going to be a delay in hospitalizations from cases by 10 days plus even. Deaths might be delayed 2 or 3 weeks, so that remains to be seen. Don't have a crystal ball. I'd like to think that our recent high Delta wave will protect us to some degree from the levels that we're seeing in some other states. In Hawaii, for example, they're seeing a much bigger spike in cases earlier before Guam, but their hospitalizations are pretty high, not as high as they've ever seen, but on the rise. So that might be a place for us to watch. There's been, the CDC has published their mortality data from 2020. I know it's already a year out, but it takes them that long to sort of finalize all the numbers. But, these blue lines down here are previous years. So the dark blue is 2015, 2018, 2019 is in light blue, and then red, that's 2020. So, something weird happened in 2020. I don't know if you guys know what that was, but obviously a number of things went into, these are total deaths in the United States, from all causes, and it's age adjusted. So some people that matters to them, but something, happened here. And of course, we know coronavirus played a big role in that, but other people are saying, well, there's other deaths. There's deaths of despair. There's deaths from people not getting their health care. And so there's somebody that I follow who did sort of a deep dive into this. And I think we've talked about the suicide rate as a concern. Interestingly, right when the U.S. got hit, there was a decrease in suicides. Kids are out of school. Actually, we think that there's something to do with being in school that causes more suicides. But what we clearly didn't see an increase in suicides in the United States, at least. And that holds true in most places, except for perhaps Japan. Interestingly, though, I think transportation accidents on the roads increase. And we think possibly because there's less cars out there, people are driving faster. Another consequence is that accidental drug overdoses increase. So these are not intentional drug overdoses like somebody trying suicide, but accidental drug overdoses increase. And what the lockdowns and what the coronavirus did to society and people's access to drugs probably has played some role here. But that definitely played a little bit of a role in the overall uptick in deaths overall. And this one I thought was really curious. These are homicides from gun violence, and this is only seen in the United States, by the way. They looked at other countries, and only homicides from gun violence did not increase during the pandemic to the same degree it did in the United States. So I thought those were just a couple cool little slides to pop up. But as you guys know, probably seen in the news, Texas Children's and Baylor's, they developed a vaccine which it's going to be patent free. They've already made 150 million doses, and they can increase the production to 100 million per month, and they're already distributing this out to India. So this is key, I think, when it comes to decreasing the number of variants that we're going to see. We've got to get the vaccine out to the entire world, especially the countries that don't have the access to the earlier vaccines. So this is really good news. As you guys were talking about earlier in the show, we know we can boost now down to 12 years old, and that we can give the booster down to 5 months from the second dose. So this is some of the latest stuff. I think we're in this wash cycle. I mean, if you think this is the last variant we're gonna see, you know, we're certainly going to see more variants. And are we going to be having to decide every time this happens what we're going to be doing? You know, I think there's very few eligible unvaccinated left in Guam. There may only be a few thousand of them, and I don't think that they're necessarily going to be driving this surge and future surges. You know, you can see in the hospitalization data, at least, you know, we've got 85% people vaccinated. It's no surprise that if we have people hospitalized, a fairly big chunk of them are going to be vaccinated already. You know, what are we going to do? How much of this are we going to live with, right, Chris? I mean, that's, you know, how much are we going to expect is going to even make a difference when it comes to this variant in particular, which is so transmissible. You know, you could say 25 limit on gatherings versus 50 limit on gatherings, and realistically, how are people going to follow it, and what difference is it actually going to make in terms of the spread? Now, when you're talking about a virus like Omicron, we're seeing already 200 cases. How high is it going to go? 300, 400? I think already we know the true number of cases. You know, we know people aren't getting vaccinated. It could be, I've seen estimates 10 to 20 times the number of you actually testing, you know, and this varies in every state. Some states it's a lot easier to get testing, others very difficult. A lot of states have a lot more at-home testing, and these people aren't even going in to get counted, you know. So I think it's easy to say we've got thousands of cases out there, that, you know, true cases out there. So in the setting of that, you're like, you want to just throw up your hands and say, well, you know, it's everywhere, you know. It's like, what do you do? You know, but I think, you know,
that's what I call the doc. That's what I call the Dr. Berg approach.
From a practical approach, though, I mean, I think focusing on you know, sort of super spreader events and you know, I think we still need to you know, I think there's two components here. There's people that are still going to die, and so if you look at the people that are dying now, and I think you guys touched on this earlier, the ones that are most vulnerable, the ones that haven't been vaccinated, maybe the low income, certain portions of our population, you know, that effort to reach out to them and getting them vaccinated, getting them treated early, I think that's critical in keeping our deaths down. And then the other side of this, which unfortunately I just don't feel like we have a good handle on, is this long COVID issue. I mean, I think it'd be easy to say, okay, I think this virus is affecting us much like the flu now, so let's just treat it like the flu and just allow, you know, not get too spun up about it, you know. But this whole long COVID issue is, you know, I don't think we've seen influenza people recovering from influenza having the same types of long-term problems as we are with COVID. And
Doc, I'm sorry, Doc, to interrupt,
Sure.
but could you just maybe give a little context about what, I mean, I know what long COVID is, but just for our listeners, if you could explain long COVID and how it makes COVID different from, like you were saying, the flu.
Well, they'll keep tabs on people after they've recovered from COVID, whether it's, you know, a mild infection or a severe infection, and particularly with the severe infections. And they'll ask them, you know, what symptoms are you still feeling? And there's a number of symptoms which are persisting for a long period of time. Fatigue, still trouble with breathing. They've even looked at elite athletes. I think there was a recent study I saw in like elite professional soccer players and the percentage of them reporting difficulties, you know, regaining their normal level of fitness is pretty striking as well. So even in fit people, they're feeling like there are lingering effects that are, you know, something that we haven't seen with other illnesses. And there's neurologic issues, cognitive function issues. There is a study that looked at cardiovascular events like strokes, heart attacks, arrhythmias, and they followed people for a whole year after they survived from a COVID infection. And there was a higher percentage of events in people that had COVID versus people that hadn't. So, you know, it's not a huge number, but it's still enough that makes you say, I still don't want to get COVID, even if I recover. I still don't necessarily want it because I don't know, maybe these long COVID effects are, but is it still to the magnitude and severity that we're going to make, you know, dramatic changes and think that we're going to achieve zero COVID and not allow the virus to spread? I mean, I think that's unrealistic. But it doesn't have to be this dichotomy of zero COVID versus let it rip, you know, obviously. But what practical things can we do? Again, try to do the things that will protect yourself, protect your family, and maybe, you know, from a public health perspective, do the things that will prevent super spreader events where we'll dramatically increase the numbers of cases in the community. I mean, yes, we're seeing probably thousands of cases in the community, but if we can decrease that even by 20%, 30% by doing some things, I think there's value to that. You know, we may not see that. We may not even realize the benefits of doing something like that. But I think that's what we need to think about here. You know, I think that it's a real, I don't know, administrative issue even nationally, where, you know, the availability of cheap and available rapid tests has been a big failure, a huge failure. I mean, we should have these on the shelf for $1 each. And you know, we can work through the reporting later, but the ability to know if you're infectious right now is huge. Yeah, it's not not as sensitive as PCR, but if you can keep repeating this test, and you know that right before you go meet with your grandparents, that you know if you're infectious or not right now. I think that there's a lot of value to that. The oral agents, while they're showing great efficacy, we just can't get them. I was reading an article about somebody who was in New York, and they called 20 pharmacies that were within driving distances, and one of them had this Pavloxid drug, which can help. And so, you know, you take a place on the East Coast with access to lots of pharmacies, and compared to Guam, you know, we're not going to have access to some of these drugs, and right now they're in demand everywhere, and there's a national surge. So. Yeah. So we'll see. I want to hope and believe, just because I'm looking at other places that have had a high Delta surge that are a little bit ahead of us in the Omicron wave. I'd like to think we're not going to see as bad of overwhelming of resources as we're seeing in other states, and that's my personal take on this. But again, practically speaking, let's be careful. Let's be smart. Let's continue to just take reasonable precautions, but also understand that this is a really nasty virus, and the transmissibility is just crazy. I mean, consider, you know, I sent a message to my staff when we saw 200 cases. I said, you know, just consider being antisocial for the next 2 to 3 weeks. Don't go out. You know, go to work, protect yourself. Consider double masking. Consider getting an N95 mask if you're really concerned. Tell your loved ones that have comorbidities just to really play it safe in the next 2 to 3 weeks. South Africa's wave, I mean, it was 3 weeks and it was essentially done. I mean, 3 weeks, that's not a terrible amount of time. It's looking worse in the UK, you know, and again, I think every location is going to be a little bit different. So we'll have to see how this plays out in Guam and you know, hope for the best.
Doc, thank you. I do have a few questions. First one here under the take-home points. Your optimistic take: it'll be less severe in Guam compared to other locations. About a 3-week surge, less than 50 hospitalized. How optimistic is this take? Because I know that you said earlier it's very hard to look at a London or Hawaii or a Maryland and say, like, that's how we're going to do, because as we all know, we've got some unique circumstances here on the island, whether it's the, you know, sick population or the fragile healthcare system. So, yeah, when you kind of look out at the lay of the land and you make this optimistic take, just how optimistic is it?
Well, I think there's definitely folks who think that things are going to be a lot worse, you know, and so I'd say it's perhaps quite optimistic compared to you know, how bad things could be, but yeah, I guess how realistic, how likely is this take to play out, you know, and you know, I don't have a crystal ball, Chris. I'm making my I'm trying to read the tea leaves here, and I'd like to think that there is reason for us to be a little bit optimistic compared to some other locations. Now, that doesn't mean, even if we get through this wave a little easier, it doesn't mean that, you know, maybe Omicron will come back and affect us a little worse down the road. Or again, if we have a period of fairly low viral activity, the next one might get us. But I just have there are differences between locations with respect to how bad Omicron is hitting them, and the ones that are doing the worst have had very low community virus activity with Delta in the previous 2 to 3 months, and we were a little bit different than that. We had a really dramatic Delta wave, and I have a feeling that's gonna protect us a little bit from this wave. And that's not to say, oh, thank goodness we had a high Delta wave. I mean, that's not the key here. Yeah. You know, we sort of paid our dues. Unfortunately, a lot of people died during that wave. I think the places that are paying their dues now with Omicron, they may end up doing better overall because Omicron is a little bit less severe. But they're still going to be suffering because of exhausting their medical resources and full hospitals and that sort of thing.
It is frustrating, Doc, when you have, the governor on one side saying prepare for a super typhoon, and then you see the high number of cases, and you look around the world and see what's going on with Omicron. But then, when it comes to measures, protocols, restrictions, we don't really change anything. So I know you had said that there's kind of this the two schools, right? Where, oh my God, zero COVID versus let her rip. So where should we be in terms of preparing for this surge that's pretty much already here? Like because I feel like, are we going to do nothing, kind of like what we did with Delta, or are we going to do something? And what something do you think would work?
Well, there's so many factors. I mean, there's what do you think the people will accept? When is the public outcry going to cause more harm than good? And that can truly happen. It's happened in many places. We're lucky that I think people still mask up outside. I mean, you talk to anybody in the States right now, it's rare to find a city where people are masking the way they are in Guam. So I think just that alone, you have to feel like, okay, we're a big step up from almost anywhere else in the U.S., right? There's financial considerations. There are real harms to businesses, and that's whether there's restrictions or not. I've had 2 or 3 staff today calling in asking, what should I do? I've got this contact, and this is only going to get worse. I mean, people are going to be saying, okay, now I've got 2 or 3 people sick in the family. What should I do? We're going to be looking at closing shop, canceling clinic if we have too many people that are calling out. So whether or not, again, because the virus is so transmissible, whether or not we make a lot of big policy changes, these things are going to happen. So the nature of the virus, I think, also is an important consideration. How useful are going to be changing little details of policy. Unfortunately, I don't feel like they're going to make big differences. I mean, with a virus this transmissible, you'd have to pretty much do something South Korea style or China style to really have a tremendous impact. And we just don't have the tolerance for that level of lockdown in Guam. So I think doing things like preventing super spreader surges, encouraging people to wear quality masks correctly in places where they're going to be around, and just simply changing your activities, which people are doing already, by the way. They see these cases and they're already making some even unconscious behavioral changes to try to protect themselves. But just to support that endeavor and to encourage people that are interested in taking those precautions, go ahead. It is you've got to think about the people that are most at risk here, and gosh, please get boosted. I mean, it really, there's no question that it helps. There's no question. So encouraging boosting, again, reaching out to those populations that are most at risk, and preventing super spreader events that might decrease the overall viral burden and overall case numbers. I think those are the practical things that we can be doing.
Doc, what about the rapid engagement team, right? So this was a team out of public health, kind of like their special forces, a SWAT team, if you will, and they would go into these areas, low income, maybe areas where, they would just go into these areas and it was testing, right? And then I think they did a couple of vaccinations, but with the booster numbers so low, in your opinion, what can we do to not just increase awareness, but to also increase the number of jabs given?
I wish I had an answer to that, Chris. I really don't know. I think I think what they've done is a good start, but engaging with these communities and being relentless on it too. Just continuing those efforts, I think, is the key. And trying new things. I don't know. I think there were times when I would see a lot of commercials and in Chuki's, for example, on the radio and on TV, and continuing to try to reach out to those communities through the avenues that have worked in the past. But being relentless about it. I mean, just continue to try and not give up on that, because that's probably where a lot of our deaths are still gonna come from, is the unvaccinated.
Right. I think it's a tough question, but there are some pretty simple answers. The messaging has always kind of been very difficult during this pandemic, like this "don't wait until it's too late." I thought this was so crucial, and we ran it for about a couple weeks, and then it kind of went away, right? But messages like this, messages like "get your booster," I mean, in a perfect world, I want to hear it everywhere. I want to hear it in the loudspeaker where they test the typhoon sirens. I want to hear it nonstop on the radio. I want to turn on the TV and I want to see people telling me to go get my booster, or people saying, hey, don't wait until it's too late. So this messaging, right, it's been really inconsistent, but do you think it's crucial now more than ever to kind of stand up consistent messaging that stays in place through these lulls and these hotspots that we're going through?
Yeah, I think so, but it's also nuanced because, there is a psychological component here where, I think if you just blast a message, people are going to tune it out too. So maybe that's not the right way to do it. I don't know. I mean, you got to, I think it has to be creative. It has to be and designed in a way that it's going to reach somebody in a way that they're going to internalize it and say, okay, I get that, versus just trying to hammer it down everybody's throat, or you can see the backlash for trying to mandate these types of things. I mean, that would be the total extreme to say we're going to mandate boosters. If you've been over 5 months from your last dose, you're going to have to get it. And you can see the backlash that would happen among certain groups, and then they're these groups that consider this a personal affront to their freedoms, to mandate. They're very vocal, and they do have an effect on others that are sort of more on the fence, and they're going to hear the message and say, yeah, there's some credibility to that. Maybe I'm not going to let them tell me what to do, no matter what the data says, So I don't think it's as simple as just putting the message everywhere. Unfortunately, I think it takes a lot more thought in the approach and how that message comes across and the avenues that you take. But in the absence, messaging is better than no messaging, right? And I'd rather have it out there than not at all. So.
Right. 18 to 39 demographic, Doc. The presentation from Dr. Ann yesterday shows that this age group continues to drive infections. How do we reach these knuckleheads?
Well, I don't know what what avenues they're using to get their information. Do you know if a lot of them are watching your show, that demographic, or is it more of an older group?
I would say it skews a little older, and I think that the 18 to 39, they're very on the social media. That's like where they get.
And it's really interesting if you probably if you look at a Facebook post that's posted by one of the media outlets, like literally 90 to 95% of the comments are from a very extremist view. That's, I think, a minority of people. I mean, I think it's clear that the majority of people think that the vaccines work and they're effective and that masking is worthwhile. But 90 to 95% of the comments on there are very negative about vaccination and about they're very conspiracy oriented. And that's just astounding to me. And I don't know, maybe that makes people just tune out and not want to engage in the conversation, because you post something there that is, would be seen as, okay, we're in this together. Let's do this, Guam. You get attacked by this group. And maybe they feel the same way, but it doesn't look like that. It looks like most of the comments are all very one-sided. But perhaps for this demographic, they just aren't engaged because they hear this very vocal, extreme, conspiracy view that just has made them say, throw up your hands again. This isn't that bad. I'm not going to worry about it. Maybe if long COVID turns out to be not a big deal, then maybe that's not a terrible view to take either in the long run. But I think there's still so much that we still need to learn about this virus, and it's definitely different than previous viruses. But I don't know, Chris. Again, these are one of the big challenges of this pandemic is how to reach the group that seems to be contributing most to the surge right now. Yeah. Again, that extremist view says let her rip. Let it get out there because absolutely. Thank goodness that it's Omicron and not Delta that is as transmissible. I mean, we could have seen 2 to 3 times the number of deaths if Delta was as transmissible. So if you're going to have a virus that more easily rips through the community, thank goodness it's one that's a little bit less virulent and one that came after we've already been able to vaccinate a lot of people. So there's that side of the conversation too.
Well, Doc, we just got a comment that I think sums up a whole lot of this 18 to 39 nonsense from Huey. I get my medical advice from TikTok. There you go. All right, Doc, thank you.
Would you consider board certified medical advice doctor.
Hey, there's some good stuff on TikTok though.
Yeah, I'm not hating. I'm just
Doc, do you follow Dr. Glockum Flockum or something? It's
Oh yeah. Yeah. He's an ophthalmologist, so of course I'm a fan.
Oh, that's right.
And
There
a
you go.
comedian. Yeah.
All
No,
right.
I don't know. I hope that comment was tongue in cheek, but honestly, you never know.
I hope so too. Doc, I love having you on. I feel like you're very reasonable, right? And you're not a wacko. I sincerely believe that you're coming from a place where you just don't want to. And I talked with a friend of mine yesterday because some of your colleagues, it's like their center is not, do no harm. And so the doctors that we get on here, I feel like they're really coming from a place where they just don't want anyone to get hurt, which, at the end of the day should be what it's all about. So I really appreciate you coming on here and just giving us your analysis in a very reasonable, moderate and measured way. Really, I can't tell you how valuable we find your time.
Thanks a lot, Chris. I appreciate that. And again, thanks to all you guys and what you do over there. And Happy New Year.
Right on.
Happy New Year, man.
See you on the other side, Doc.
All right.
Not that other side. I meant the other side of this surge.
Well, maybe we'll see you on TikTok. You never know.
Easy way.
No time.
Yeah.
Ain't nobody got time for that, Jay.
I actually did want to be Dr. Pimple Popper, but I heard that name's taken already. So.
It's 8 o'clock. We're KUAM FM. I got in Guam. It is Friday, January 7th. We're about to go in on the news. We did have some Huey comments, jokes. Stay safe and listen to the medical professionals.
There you go.
Wash your hands and wear your mask. So the takeaways there from the doc, and this is where I think it gets really iffy for me, not with Dr. Lombard, but because it is, right? They're saying that it's less severe than Delta. And so people hear that and they're like, oh, it's less severe than Delta, right?
And they don't hear the rest of the sentence that comes after that. It's like they stop at that part.
Right. And so, I guess it is less severe than Delta, but it could be pretty severe for a lot of people in our island community, which again, it just goes back to where we were at the beginning. We got to protect those who are vulnerable and those who wouldn't do so well if they did get sick. And
we don't have an unlimited number of beds in the hospital. Yeah. With the hospitals that we do have too, it's, it can very somewhat easily become overwhelmed, and that is the major concern.
So good morning. It's 8 o'clock. You ready? We're going to jump over to KUAM TV. We got the news. We got Maria Pangilinan. We're going to talk about the election. Yep, as the packets are ready for pickup here on Guam. We're KUAM FM. We got Guam on the breeze. KUAM TV. Fix yourself. Here we come. Good morning.